Hello, a cheerful heart is good medicine, Proverbs 17:22. So today was day 6 of my radiation therapy for Acinic Cell Carcinoma, although I don't have that anymore. It's just a follow-up. So I want to tell all of you who might be experiencing radiation of this type about my first actual what they call here at MD Anderson weekly C appointment, which is a clinic appointment every week where you meet with the nurse, the physician's assistant, and the actual radiology oncologist. And you can bring up any issues. The doctor gives you an exam, and you can refill or get any new prescriptions. They can send you off for other appointments to people if you need it. So I weighed in, and they were all very excited because I've been eating so much, really have, that I actually put on half a pound since the first time, I think a couple weeks ago, when they weighed me in. So I'm keeping up with that, obviously. I told them that not a new symptom, but a symptom I've been having for, well, probably dating all the way back to the surgery, but it's gotten much more pronounced, and it seems like after every meal, I have a lot of acid in my stomach, not heartburn, but like acid in my stomach, and it's not quite into nausea, but it feels like it could tip into it. It doesn't keep me from doing anything, but it makes me feel a little bit less perky, and I certainly wish it would go away, but it's not the worst thing in life. So I've been trying some different things. Pepsid, um, you know, they're pink and they really taste good, and they maybe help just a smidgen. I've tried to figure out if I'm eating something, and I don't think that I'm eating anything that would really cause me the acidity. I've given up my Diet Cokes because of the carbonation, not because of this, but because I need to. But that hasn't changed the acidic level in my stomach, so I don't really have a rhyme or reason. For example, this morning I had a bowl of Fiber One cereal, which is recommended, and I sliced up pretty much an entire banana, and I had my organic skim milk, and that was at 6:30, and my acid started about 9 o'clock, and I hadn't had nothing since then except for drinking water. So I don't have a good handle yet on that. My doctor did prescribe me a long-worded name for a anti-nausea medicine. I took that as soon as I got it, but it didn't change the acidity. So I will keep that up on the shelf. Should I actually feel some real nausea, we'll give that a try. One of the things that my doctor noticed is that I've got my earrings on, and these are pretty much what I wear all the time. And of course, when you go in for your radiation therapy, you have to, for me, because and if you're watching for information, you want to wear pants or a skirt or something because you undress from the waist up, and you have to take off, of course, all your jewelry. So, and they give you a towel. But he said, oh, not only do I need to take them out, but I need to use alcohol swabs before I stick them back in my ear. I need to clean them, and I need to clean, my earlobes every day, right after I had the radiation. He said that would be to prevent infection. So that was something I hadn't thought about. I hadn't read anywhere. So it's probably just a good hygiene practice anyway, but he wanted me to do it every day. So we went to the drugstore, and the little alcohol uh, individual packets like they give you at, I don't know, if you're going to eat crab legs or something messy, barbecue ribs. So we bought some of those, and I've got them in a little Ziploc bag, and now I carry that in my bag that goes in with me. So I'll get that started. Um, the other thing I learned at the appointment today with the doctor was that the nurse practitioner took my blood pressure and my heart rate sitting, and then she had me stand. And she took it standing. She waited about a minute or so after I stood up, and then she took it again. And so we asked why, and she said, well, it's to see the difference between sitting and standing. Okay. Then the physician's assistant came in and read all of the nurse's notes and said, are you drinking enough fluids? And I said, yes. I mean, I'm really paying attention to it. I said, I've actually gone all the way over to like 64 ounces or so of just water. Yesterday I said I got about 51 ounces, and I got some other fluids because they want you to have, they told me 64 ounces of fluid a day. Half have to be no caffeine. So I just decided, just drink a lot of water. I mean, that's so good for you anyway, right? So the nurse practitioner said that the difference in the heart rate sitting and standing was telling her that I was not drinking enough fluid. So that's not good. So we'll see if at the next appointment in a week, if that's still the case. But I told her I'm writing it down, so I know I'm getting at least 64 ounces and following the rules about how much caffeine and not. So we'll see. But that was something I had never heard before. I don't think anybody's ever done that kind of test before. So if you go through this, that's a clue is if you're getting enough fluid. Now, I also then, after lunchtime, had my regular radiation therapy appointment, and today was the day they had gotten permission because my mouth stent is so tight on this front section of teeth that it's fine once you put it in your mouth, but when you lay down and they put the the face mask over top of you and they clamp it down, it is so tight that it has been really pushing on this tooth. So they got permission, they heated it up with their hair dryer and put it on and was able to lift it just ever so slightly, and it felt better. So I'm thankful for that. But what happened when they clamped it down, uh, the pressure today across my brow line was just painful. And I was like waving, like, and it's hard to, when you're clamped down to your shoulders, you don't have as much movement, so I couldn't hardly do that. My sister went in with me, and she said, no, she's not okay. So they started to lift it out, and then they realized that the mask was still not completely hardened again from them warming it up. So they had to put it back down and fanned it to get it to harden sooner. They took it off, and I told them about this, and they said, we can't do anything again to the mask without the doctor's permission. I said, it's fine. I said, maybe I'm not up as far into the shoulder foam piece. So we pushed me back up into it a little bit tighter, and that did help. It helped enough that it was fine. But another thing that's been happening since last week is that it's so tight. I think I talked about swallowing, and it's kind of hard to swallow. You just have to know you can. But probably since Thursday or Friday last week, and then again today, I'm having more tightness and pressure against my top of my throat that now it's becoming difficult to actually just swallow. So when the radiation was done, I told him about that, and I said, we talked about it, and I said, let's try it again tomorrow and see if I'm still having trouble. I said, my concern is if I get any more, if I'm having swelling and that's causing the problem, if I get any much more, I'm not going to be able to swallow, and that's a concern for down the road. So we said we would try it again tomorrow and then talk about it afterwards, so I'll let you know if we make a change. Um, so the important thing to get out of all of this is that uh, they want you to be as tight as you can be comfortably. They like it, the tighter the better, because it's going to keep you in position every time, and so those radiation beams are going to be more precise and go into where exactly they want them to go. However, if you're uncomfortable, they want you to be as comfortable as they can. So my suggestion to you is speak up. Don't be overly concerned. You're not going to hurt their feelings, but some things they're going to be able to fix, and some things they might not. But I think being able to swallow is something they're going to have to be okay with, having be comfortable enough to do that. I'm just looking at my list because I had a lot of things I wanted to say today. So my silver lining today is it's kind of hard to go and sit in the waiting rooms. I say hard because you're looking around at people that are obviously the patients, and you're looking around at people that are the loved ones, the caregivers for the patients. And it can be kind of hard sometimes to see the people that maybe are further down the road, or they're having therapy maybe on a different part of the body, and it just can be hard to watch. And a lot of people are older than I am. Occasionally you'll see a younger person, but probably most people are 10 to 20 years older than I am, and it's just so hard to see some obvious pain. So my thought was, what I really felt very strongly about was I just wanted so badly to go around and give everyone a hug. But I didn't feel like I could do that. So someone helped me come up with the idea to buy the Hershey Kisses hugs, the milk chocolate and the white chocolate that are spiraled together, or at least the outside is anyway, and they say hugs. So I got a bag, and I had 2 appointments today, right? The clinic and then the therapy. And each one I walked into the waiting room to all the people that were sitting there, and I just walked up and I said, "Do you mind if I give you a hug? This is a hug from me to you." And the looks on everybody's faces were just like, yes, thank you. And it was just kind of a sweet moment to have. So there are silver linings. There are all those wonderful people in those waiting rooms, and we're all in it together. And I think that just helps makes people, I hope, makes them feel a little bit more comfortable that we're all in it together. So, bye for now. I'll see you in the funny papers.